right, good afternoon, everyone. I hope everyone was able to enjoy a good lunch and now recharge to proceed with our afternoon session. We're going to start with the spinal oncology portion of the meeting, and to kick things off, we have Dr. Vivek Gupta, esteemed neuroradiologist at Mayo Clinic, Florida, to guide us through the imaging for primary spinal tumors.
Thank you, Selby, for inviting me. It's a privilege to be here, and it's a great day in Florida, bright sunshine after a few days of rain. We're having such great weather. I would encourage everybody after the meeting to really enjoy this time in this part of the world. So the idea of my talk is to sort of give you a sort of a whirlwind tour of primary bone tumors in spine. Primary bone tumors in spine are rather rare birds. Majority of spine tumors are metastatic lesions, so I would say less than 5% of all spine tumors are actually primary bone tumors of spine. But I think it is important to be familiar. Some of them can be difficult to differentiate from metastatic disease. Of course, then we have a sort of a variety of ways to find out what it is, and some of the lesions can actually be treacherous to find, as we will see. And other lesions, sometimes the decision whether or not to sit upon them can be challenging. So some of them are clearly lesions that just need to be watched and not acted upon. And we will go through some of the features and how we go about just deciding whether to sort of do something about it or just watch it. All right, I have no disclosures. So here is the basic learning objective, which is fairly straightforward. So let's just take a look at this case. And I would encourage you to sort of shout out if you have the diagnosis. And so we talk about a common entity here that we see in the spine all the time. We don't see this manifestation of this entity. This is a rather rare clinical manifestation of this rather common entity. Any takers? Absolutely. So what I want to point out here is that we all know that hemangioma is an extremely common lesion seen in up to 40% of spine exams. They can be variable in size. It can be small to large. And they're usually sort of totally innocuous observations. And the characteristic feature of a spinal hemangioma is that it tends to contain a lot of fat. So there is proliferation of fat around the vascular component, and that's a very sort of a giveaway feature that is very